Hi guys, my name is Helen Gardner and I'm going to be talking about carbidopa used to treat Parkinson's disease. So Parkinson's disease is a brain disorder that causes unintended or uncontrollable movements such as shaking, stiffness, and difficulty with balance and coordination. Symptoms usually begin gradually and then they worsen over time. And as the disease progresses, people may have difficulty walking and talking. So these are just some Parkinson's symptoms. There's tremor in the hands, arms, legs, jaw, or head, muscle stiffness, where muscle remains contracted for a long time, slowness of movement, impaired balance and coordination, and sometimes leading to falls. Um, and then other symptoms may include depression and other emotional changes, difficulty swallowing, chewing, and speaking, urinary problems or constipation, or skin problems. And the symptoms of Parkinson's and the rate of progression differ among individuals. Early symptoms of this disease are subtle and occur gradually. For example, people may feel mild tremors or have difficulty just getting out of a chair. They may notice that they speak too softly or that their handwriting is slow and looks cramped or small. Friends or family members may be the first to notice changes in someone with early Parkinson's. And then they may see that that person's face lacks expression and animation, or that the person does not move an arm or leg normally. So typically it starts in one limb on one side of the body and then will worsen over time. And then carbidopa is a drug given to people with Parkinson's disease in order to inhibit peripheral metabolism of levodopa. And it allows a greater proportion of peripheral levodopa to cross the blood-brain barrier for the central nervous system effect. This property is significant in that it allows a greater proportion of levodopa to cross the blood-brain barrier. It remains the most effective drug to treat Parkinson's disease. In addition to helping prevent nausea, carbidopa prevents levodopa from being converted into dopamine prematurely into the bloodstream and allows more of it to get to the brain. And levodopa is in the class of medications called central nervous system agents. It works by being converted into dopamine in the brain. And then carbidopa is in the class of medications called decarboxylase inhibitors, and it works by preventing levodopa from being broken down before it can reach the brain. And then this also allows for a lower dose of levodopa, which causes less nausea and vomiting. And then X-ray crystallography can be used, and it's pretty much an experimental science determining the atomic and molecular structure of a crystal. And then the crystalline structure causes a beam of X-rays to diffract into many different directions. And then the aim of X-ray crystallography is to obtain a three-dimensional molecular structure from a crystal, and it's a purified sample at a high concentration. It's crystallized, and the crystals are exposed to an X-ray beam. And then this shows the chimera of the crystal structure of dopa decarboxylase in complex with the inhibitor carbidopa. And the crystal structure of dopa decarboxylase with the inhibitor carbidopa, dopa decarbolase, also known as DDC, is responsible for the synthesis of the key neurotransmitters dopamine and serotonin. And then it's C10H14N2O4. And then this is just the molecular structure. So I hope that summed up a little bit about the carbidopa and how it's used to treat Parkinson's disease.